Hello, my name is Amanda Parsons, and for my health policy presentation, I will be focusing on Virginia House Bill 620, entitled A Bill to Amend and Reenact 32.1 to 325 of the Code of Virginia relating to medical assistance services and payment for essential hygiene products. There are numerous demographic characteristics that are important to reflect on in relation to this bill. From the 2020 United States Census, there were 8.6 million residents reported with a median age of 39.3. Just over 17% of Virginians are 65 years of age or older. Nearly 18% speak a language other than English at home, and 13.3% were born outside of the United States. In relation to the socioeconomics of Virginia, nearly 16% of rural residents were at or below the poverty level in 2022, as well as 9.5% of residents in urban locations across the state. Virginia's median household income is just over $12,000 more than the U.S. average of just over $89,000 and $77,719, respectively. Just to add to the overall profile, 41% of Virginian adults over 25 have a bachelor's degree or higher. In terms of the racial and ethnic makeup of the state, 60.7% reported as being white and non-Hispanic, 19.1% as Black, 10% with their ethnicity as Hispanic or Latino, 7% as Asian, 2.8% of multiracial, and 0.3% American Indian or Alaska Native. There are also multiple health-related aspects of Virginia that are important to consider when advocating for a bill such as House Bill 620. For example, in the 2020 United States Census, 12.8% of residents reported having a disability. 2 million women were of fertility age of 15 to 50 years old, and the average life expectancy in 2020 was 77.6 years old. In regards to health insurance, 1.9 million Virginians were enrolled in Virginia Medicaid, with 17% of the state population covered by either Medicaid or the Children's Health Insurance Program, commonly referred to as CHIP. And 6.4% of the state is without any health insurance or coverage. The legislative committee attached to House Bill 620 is the Committee on Health and Human Services, chaired by Delegate Mark Sickles and vice chaired by Delegate Kathy K.L. Tran, with the 20 additional members, with 10 Democrats and 10 Republicans. This committee focuses on health, behavioral health, social services, and health profession related bills. Within a few weeks of the bill's creation, it was moved to the subcommittee of social services within the Committee on Health and Human Services. This subcommittee, is chaired by Delegate Kathy K.L. Tran, with 8 additional members, 5 Democrats and 3 Republicans. The public health issue at hand is the importance of personal hygiene, which helps prevent the spread of disease and avoidable illnesses, as well as leads to better overall health and everyday self-confidence. The hygiene items included in House Bill 620 are diapers, baby wipes, toothpaste and toothbrushes, dental floss, body wash and soap, shampoo and conditioner, deodorant, feminine hygiene products, sunscreen, and toilet paper. Most importantly, the Department of Medical Assistance Programs estimated that the average monthly cost of over-the-counter hygiene products identified in the bill to be around $36 per member, which could easily be a barrier to many individuals. The demographic characteristics of those involved with the bill are those in Virginia enrolled in Medicaid or CHIP. The race and ethnicity breakdown of enrollees is remarkably similar to the state breakdown, with 53% white, 34% Black, 5% Asian, 4% reported ethnicity as Hispanic or Latino, 6% as other, 1% of both Native Hawaiian, Pacific Islander, and American Indian or Alaskan Native. In terms of ages of enrollees, most enrollees are 19 years or older, considering that CHIP is included. And oddly enough, only 7% are 65 years or older. More women are enrolled at 55% compared to 45% male, and Fairfax and Prince William County have the most enrollees at 171,203 and 104,005, respectively. The goal of this legislation is to direct the State Board of Health to include a provision for the purchase of essential hygiene products through Virginia Medicaid and CHIP. The most appropriate health equity framework to explain the efforts of House Bill 620 is the Centers for Medicare and Medicaid Services, or CMS, their framework for health equity that they used in 2022 to 2023. This framework was built upon the idea of the Healthy People 2000 health promotion programming from the U.S. Department of Health and Human Services. CMS used their health equity framework to, in part, address and work to resolve the inequities that already exist within their programs. This notion of addressing inequities or disparities within Medicare and Medicaid is exactly what House Bill 620 hopes to accomplish if this bill is passed and amends the Code of Virginia. There are multiple advantages and disadvantages to this pathway to achieve health equity. For example, outside of increasing the general understanding of existing disparities and promoting sustainable actions, enacting change at the policy level for medical assistance programs can have a downstream effect on other healthcare stakeholders. In contrast, there are still disadvantages to consider, such as bills not passing, general bureaucratic red tape, and the overall timeliness of enactment. There are a few points to consider when discussing the estimation of effectiveness of House Bill 620. First, within the fiscal implications included in the summary of the bill, delegates included that the funding could be distributed in different ways to enrollees, such as EBT or electronic balance transfer debit card system, a pharmacy benefit system, member reimbursements, or direct payments to enrollees. Those involved with the fiscal implications have also shared that they anticipate relatively high utilization. Similarly, within the bill's guidelines, enrollees would have the option to increase benefits to cover additional personal hygiene items not previously listed. And finally, there is the potential for this program to receive federal matching funds, which would increase the amount of support available. There are two main points in favor of passing House Bill 620. First, addressing health equity through a policy provision is necessary to provide Virginians on Medicaid and CHIP the ability to purchase necessary personal hygiene products that cost enrollees an average of $36.32 a month. Second, just over 1.8 million Virginians could not only purchase personal hygiene products, but improve their health, show up healthy for others, and prevent avoidable illnesses. And importantly, the World Bank quotes that hygiene promotion is one of the most cost-effective ways to reduce disease. In summary, Virginia House Bill 620 would not only bring daily support through the ability to purchase personal hygiene products to Virginians all over the state, but it will grant Virginians the ability to show up and be successful each and every day, as the greatest wealth is health. Thank you.